Dr. Montes, thank you for accepting this interview.
Pleasure.
What is the botulinum toxin and what's its use for cosmetic reasons?
Botulinum toxin is basically a protein that you inject in specific muscles on the face in order to relax them. When you relax those muscles, you have the effect of improving the so-called expression lines, but there are other benefits to the applications that has to do with improving sometimes symmetry in these patients.
Dr. Montes, what is the botulinum toxin and how is it used for cosmetic reasons?
First of all, I want to say that botulinum toxin is a protein, is a natural product, and the purpose to inject this protein in your face is to improve the so-called expression lines. And the patients after the treatment experience a relaxation that makes them look and appear younger in some occasions and relax.
Dr. Montes, how is the treatment given?
The medication is injected in tiny needles at your doctor's office in a basically painless way.
Dr. Montes, how long does the treatment last?
After you get injected, you should expect to experience within 3-4 days an ongoing relaxation of the injected site or muscles, and this relaxation or effect should last between 3 or 5 months. There are some patients in which the effect lasts longer, but it's believed that in those patients it's because the patients learn not to recruit those muscles too actively.
Dr. Montes, roughly how many treatments have you given in your medical experience?
I started using the medication on 1991-92 for medical reasons, blepharospasm, which is a disorder in ophthalmology, and after that I moved on 1993 to use the medication for cosmetic reasons, and since then I believed that I have treated over 5,000 patients with this medication.
Dr. Montes, what are those complications that you have seen in about 1 to 2% of patients?
Well, once in a while you see a patient. Let's define what is a complication. Complication is probably an event unexpected for the patient or for the physician. And I think that among the complications, one of them is probably that the patient believed the medication or the treatment didn't work as he expected. What I do in those situations, I ask the patient to come to the office and we both examine pictures of before the treatment and after the treatment. And then most of the time the patient basically gets convinced that there is no complication and that they indeed get a good effect.
Dr. Montes, what are the complications that you have seen in these over 5,000 cases you've treated?
I think one of the most common complications is probably bruising, a small hematoma on the injection area, and this is something that it's lasts probably within few days. So
is this common or is this uncommon?
This is a rather uncommon complication, and you can basically avoid this if you use the proper technique.
Dr. Montes, have you seen any severe complication in the eye or for the general health of the patient?
The only complication that is described and that I have seen in probably 1% of the patients is probably a little bit of a droopy eyelid after the injection. As I said before, this is a rather uncommon complication, usually lasts for 2 weeks, and during the time that, that the eye is droopy, there are certain eye drops that can be used to manage this.
Dr. Montes, using Botox and fillers, would you be able to avoid surgery?
I think that injectables like botulinum toxin and fillers are basically a complement to surgery. You can enhance the results of any surgery with these treatments, and in some patients that are not ready for surgery or that has no indications for surgery, you can do injectables of botulinum toxin or fillers as a first line of treatment.